Question 1. A healthcare organization is experiencing an increase in patient falls with injury. Which quality improvement tool would be most appropriate for systematically identifying the underlying causes of these events? A. Pareto chart. B. Flowchart. C. Root cause analysis, RCA. D. Histogram. Answer, C. Root cause analysis, RCA. The question centers on identifying the underlying causes of an adverse event like patient falls. Root cause analysis is the most appropriate tool because it is a systematic process for identifying the fundamental reasons for problems, rather than just the superficial symptoms, especially after a Sentinel event or significant safety issue has occurred. For instance, an RCA might reveal that falls are due to insufficient staffing, inadequate patient education, or poor lighting, rather than simply attributing them to patient unsteadiness. Remember, for serious safety events, RCA helps you dig deep to find and fix the true issues. Question 2. A quality professional is tasked with implementing a new protocol for medication reconciliation. Which quality improvement model best supports rapid cycle testing and continuous learning for this implementation? A. Six Sigma. B. Lean methodology. C. Plan Do Study Act, PDSA, cycle. D. Failure mode and effects analysis, FMEA. Answer, C. Plan Do Study Act, PDSA, cycle. This question tests the understanding of various quality improvement methodologies, with rapid cycle testing and continuous learning as key clues. The Plan Do Study Act, PDSA, cycle is a cornerstone of continuous quality improvement, specifically designed for small-scale tests of change, learning from the results, and then refining and implementing improved processes. For example, testing a new medication reconciliation form on one unit, evaluating its effectiveness, and then adjusting it before wider rollout is a classic PDSA application. Always think PDSA when you need to quickly test, learn, and adapt. Question 3. A hospital aims to improve its patient satisfaction scores related to discharge instructions. They decide to compare their current scores and practices against those of top-performing hospitals known for excellent discharge processes. This comparison is an example of which quality management strategy? A. Benchmarking. B. Lean methodology. C. Process mapping. D. Risk assessment. Answer, A. Benchmarking. The core concept here is about comparing an organization's performance or processes against the best-in-class or top performers, which is precisely the definition of benchmarking. The clue "compare their current scores and practices against those of top-performing hospitals" directly points to this strategy. Benchmarking allows organizations to identify gaps in their own performance and adopt successful strategies from others to improve, such as observing how top hospitals effectively use patient navigators to explain discharge plans. Remember, benchmarking is all about learning from the best to become better. Question 4. Which of the following best describes the primary goal of creating a just culture within a healthcare organization? A. To eliminate all human error through punitive measures. B. To encourage reporting of errors by distinguishing between human error, at-risk behavior, and reckless behavior. C. To hold all individuals equally accountable for adverse events, regardless of their role. D. To protect the organization from legal liability by documenting all staff mistakes. Answer, B. To encourage reporting of errors by distinguishing between human error, at-risk behavior, and reckless behavior. The concept of a just culture is crucial for patient safety and is directly addressed by this question, with primary goal being the key focus. A just culture seeks to create an environment where staff feel safe to report errors and near misses without fear of unjust punishment, by clearly differentiating between simple human error, conscious but often unintentional at-risk behavior, and deliberate reckless behavior that warrants disciplinary action. For instance, a nurse who accidentally gives the wrong dose due to a system flaw would be supported and the system investigated, while a nurse intentionally bypassing safety protocols would face consequences. The main takeaway is that a just culture fosters learning from mistakes, not just punishing them. Question 5. In the context of healthcare quality, what is the primary purpose of a control chart? A. To display the frequency distribution of a single variable. B. To show the relationship between two variables. C. To monitor process variation over time and distinguish between common and special causes. D. To rank causes from most frequent to least frequent. Answer: C. To monitor process variation over time and distinguish between common and special causes. This question tests knowledge of quality improvement tools, specifically control charts, with primary purpose guiding the answer. A control chart is a statistical process control tool used to observe a process's performance over time, identifying when variation is due to common causes, inherent to the system, versus special causes, assignable, specific events. For example, a control chart tracking surgical site infection rates can show if a recent spike is a random fluctuation, common cause, or if a specific change in protocol led to it, special cause, prompting investigation. Always think of control charts as your go-to for understanding process stability and variation. Question 6. A hospital wants to proactively identify potential failures in its new electronic medication administration system before they lead to patient harm. Which risk assessment tool would be most suitable for this purpose? A. Root cause analysis, RCA. B. Pareto chart. C. Failure mode and effects analysis, FMEA. D. Fishbone diagram. Answer: C. Failure mode and effects analysis, FMEA. The question emphasizes proactively identify potential failures and, before they lead to patient harm, which are key indicators for a specific type of risk assessment. Failure mode and effects analysis, FMEA, is a systematic, proactive method for evaluating a process to identify where and how it might fail, and to assess the potential impact of different failures. For instance, an FMEA for a new medication system might identify that a specific alert could be overlooked, leading to an incorrect dose, allowing the team to design safeguards before the system goes live. Remember, FMEA is all about preventing problems before they occur, not analyzing them after. Question 7. According to the Joint Commission, TC, a Sentinel event is defined as A. Any unanticipated event in a healthcare setting resulting in death or serious physical or psychological injury to a patient or patients, not related to the natural course of the patient's illness. B. A minor error that causes no harm to the patient but requires additional monitoring. C. An event that could have caused harm but did not, also known as a near miss. D. Any event requiring disclosure to the patient, regardless of outcome. Answer: A. Any unanticipated event in a healthcare setting resulting in death or serious physical or psychological injury to a patient or patients, not related to the natural course of the patient's illness. This question directly tests knowledge of a critical term in patient safety, Sentinel event, as defined by a major accrediting body, the Joint Commission, TC. A Sentinel event is characterized by serious harm, death, severe physical or psychological injury that is unexpected and unrelated to the patient's underlying condition, demanding immediate investigation through a root cause analysis. For example, a patient undergoing a routine procedure who develops an unexpected, severe allergic reaction leading to permanent brain damage would be considered a Sentinel event. Remember, Sentinel events are serious, unexpected harms that trigger a mandatory and thorough review process. Question 8. A quality improvement team is using the DMAIC methodology to reduce surgical site infections. In which phase would the team collect baseline data on current infection rates and process adherence? A. Define. B. Measure. C. Analyze. D. Improve. Answer: B. Measure. This question focuses on the specific phases of the DMAIC: define, measure, analyze, improve, control, methodology, commonly associated with Six Sigma, and the keyword collect baseline data is crucial. The measure phase is dedicated to collecting reliable data on the current process performance to establish a baseline, quantify the problem, and identify potential areas for improvement. For example, before implementing new protocols, the team would gather data on current infection rates, hand hygiene compliance, and antibiotic administration timing to understand the current state. The measure phase sets the factual foundation for all subsequent improvement efforts. Question 9. In a healthcare setting, the primary goal of lean methodology is to A. Increase staffing levels to improve patient-to-staff ratios. B. Identify and eliminate waste to improve efficiency and value for the patient. C. Implement new technology solutions regardless of cost. D. Focus solely on reducing medical errors through punitive measures. Answer: B. Identify and eliminate waste to improve efficiency and value for the patient. This question assesses understanding of lean methodology, with primary goal and healthcare setting providing context. Lean methodology is fundamentally about maximizing customer value while minimizing waste, which in healthcare translates to eliminating non-value-added activities and resources to improve efficiency, patient flow, and overall quality. For example, reducing patient wait times by streamlining admission processes or minimizing excessive documentation steps are direct applications of lean principles aimed at eliminating waste. Always remember, lean helps you identify and remove anything that doesn't add value to the patient experience or the process. Question 10. Which of the following describes the process dimension within Donabedian's framework for evaluating healthcare quality? A. The physical and organizational characteristics where care is delivered, e.g., facilities, equipment, staff qualifications. B. The actual delivery of care, including diagnostic, treatment, and preventive services, e.g., adherence to clinical guidelines, communication. C. The effects of care on the health status of patients and populations, e.g., mortality, readmission rates, patient satisfaction. D. The financial cost of delivering healthcare services. Answer: B. The actual delivery of care, including diagnostic, treatment, and preventive services, e.g., adherence to clinical guidelines, communication. This question directly tests knowledge of the Donabedian model's three dimensions of quality: structure, process, and outcome. The process dimension specifically refers to what is done in healthcare, encompassing the actual activities, interactions, and care delivery methods. For example, adhering to a sepsis protocol when a patient presents with symptoms or ensuring effective patient-provider communication are examples of process measures. Remember, process measures tell you if care is being delivered correctly, whereas structure is about resources and outcome is about results. Question 11. A healthcare quality professional is facilitating a team to improve patient throughput in the emergency department, ED. The team has identified several steps in the patient journey that cause delays. Which tool would be most effective for visualizing the entire patient flow and identifying bottlenecks? A. Histogram. B. Pareto chart. C. Scatter diagram. D. Flowchart. Answer D. Flowchart. The question asks for a tool to visualize the entire patient flow and identify bottlenecks in a process, making a flowchart the ideal choice. A flowchart is a diagram that graphically represents the sequence of operations, movements, or decisions involved in a process, making it very effective for understanding complex processes and pinpointing areas of inefficiency or delay. For example, mapping out the steps from patient arrival in the ED to discharge or admission can clearly show where patients are waiting unnecessarily. When you need to see the whole process step by step, a flowchart is your best friend. Question 12. A healthcare organization is struggling with high rates of healthcare-associated infections, HAIs. Which of the following is the most effective initial strategy for addressing this issue? A. Immediately dismissing staff members who have documented breaches in infection control. B. Investing heavily in new, expensive antimicrobial surfaces for all patient rooms. C. Implementing evidence-based infection prevention bundles and monitoring adherence. D. Relying solely on antibiotic stewardship programs to reduce bacterial resistance. Answer C. Implementing evidence-based infection prevention bundles and monitoring adherence. The question concerns reducing healthcare-associated infections, HAIs, and most effective initial strategy is the key phrase. Implementing evidence-based infection prevention bundles, which are structured sets of 3 to 5 evidence-based practices that, when performed collectively and reliably, have been shown to improve patient outcomes, is the most effective initial approach. For instance, a central line-associated bloodstream infection, CLABSI, prevention bundle might include hand hygiene, maximal sterile barrier precautions, chlorhexidine skin antisepsis, optimal catheter site selection, and daily review of line necessity. Focusing on consistent application of proven practices is fundamental to preventing HAIs. Question 13. What is the primary purpose of a peer review process in healthcare quality? A. To ensure compliance with financial regulations and billing accuracy. B. To evaluate the quality and appropriateness of medical care provided by a practitioner, typically by other practitioners in the same field. C. To determine staffing needs and allocate resources effectively within a department. D. To conduct annual performance appraisals for all clinical staff. Answer B. To evaluate the quality and appropriateness of medical care provided by a practitioner, typically by other practitioners in the same field. This question defines the core function of peer review, a critical component of professional accountability and quality assurance in healthcare. Peer review involves clinicians evaluating the clinical performance of their colleagues to ensure adherence to standards of care, identify learning opportunities, and maintain professional competence. For example, a committee of physicians might review a case where a patient had an unexpected outcome to determine if the care provided met established guidelines and best practices. Remember, peer review is about self-governance within the medical profession to uphold quality standards. Question 14. An organization is preparing for an accreditation survey. Which of the following best describes the main benefit of achieving accreditation from bodies like the Joint Commission or DNVGL? A. It guarantees increased reimbursement rates from all payers. B. It demonstrates commitment to quality and patient safety, enhances public trust, and meets regulatory requirements. C. It legally exempts the organization from all state and federal oversight. D. It primarily serves as a marketing tool without significant impact on care processes. Answer B. It demonstrates commitment to quality and patient safety, enhances public trust, and meets regulatory requirements. This question asks about the main benefit of accreditation, a crucial aspect of healthcare quality management. Achieving accreditation from recognized bodies signifies that an organization has met rigorous national standards for quality and patient safety, which not only builds public confidence and trust but also often fulfills governmental regulatory requirements for participation in programs like Medicare and Medicaid. For instance, an accredited hospital is recognized as having robust safety protocols and continuous quality improvement efforts. Accreditation is a comprehensive process that validates an organization's dedication to providing high-quality, safe care. Question 15. A healthcare organization is implementing a new electronic health record (EHR) system. To ensure data accuracy and reliability, which concept is most important to address during the implementation phase? A. Data accessibility. B. Data interoperability. C. Data integrity. D. Data security. Answer C. Data integrity. The question focuses on data accuracy and reliability during the implementation of a new EHR system. Data integrity is the most critical concept to ensure that data remains consistent, accurate, and trustworthy throughout its entire life cycle, from collection to storage and retrieval. For example, ensuring that a patient's allergy information entered into the EHR is always correct and doesn't get corrupted or inaccurately modified is a matter of data integrity. Without strong data integrity, even an accessible and secure system will provide unreliable information, potentially leading to errors in patient care. Question 16. A quality improvement team has developed a new protocol to reduce medication errors. Before full implementation, they want to pilot the change on a small scale. This action aligns with which phase of the Plan Do Study Act, PDSA, cycle? A. Plan. B. Do. C. Study. D. Act. Answer B. Do. This question specifically asks about the phase of the PDSA cycle where a change is piloted on a small scale. The do phase is where the planned change is actually carried out, tested, and data is collected. For example, introducing the new medication error reduction protocol to a single nursing unit for a trial period and meticulously documenting the process and outcomes constitutes the do phase. Remember, the do phase is where you put your plans into action, even if on a limited basis, to gather real-world data. Question 17. Which of the following is a key characteristic of effective communication in promoting a culture of safety? A. Limiting communication to formal written reports to avoid misinterpretation. B. Encouraging open dialogue, active listening, and psychological safety for all staff to speak up. C. Directing all safety-related communication through a single, designated leader. D. Communicating only positive outcomes and avoiding discussion of errors or near misses. Answer B. Encouraging open dialogue, active listening, and psychological safety for all staff to speak up. The question addresses effective communication's role in a culture of safety. A truly safe culture thrives on transparency and psychological safety, meaning staff feel comfortable speaking up about concerns, errors, or near misses without fear of blame or retribution. For instance, in a huddle, team members should feel empowered to voice potential patient safety issues they observe. Fostering open dialogue and active listening ensures that all voices are heard and potential risks are identified and addressed proactively, which is fundamental to preventing harm. Question 18. A CPHQ professional is tasked with leading a team to reduce patient readmissions for heart failure. Which of the following leadership approaches would be most effective for empowering team members and fostering innovative solutions? A. Authoritarian leadership, dictating all improvement strategies. B. Laissez-faire leadership, allowing the team to operate without any guidance or accountability. C. Transformational leadership, inspiring and empowering team members to contribute to a shared vision. D. Transactional leadership, focusing solely on rewards for meeting predefined targets. Answer: C. Transformational leadership, inspiring and empowering team members to contribute to a shared vision. This question explores leadership approaches in quality improvement, with empowering team members and fostering innovative solutions as crucial clues. Transformational leadership is highly effective in quality improvement because it inspires and motivates team members to go beyond their self-interest for the good of the organization, encouraging creativity and ownership of the improvement process. For example, a transformational leader would involve the heart failure team in brainstorming new discharge planning ideas rather than just assigning tasks. Remember, transformational leaders build enthusiasm and commitment, driving collective success in quality initiatives. Question 19. What is the primary purpose of conducting a failure mode and effects analysis, FMEA, in a healthcare setting? A. To investigate adverse events after they have occurred to determine their root causes. B. To retrospectively review patient charts to identify deviations from clinical guidelines. C. To prospectively identify potential failures in a process and assess their severity and likelihood before they occur. D. To measure the financial impact of quality improvement initiatives on the organization. Answer: C. To prospectively identify potential failures in a process and assess their severity and likelihood before they occur. The core concept tested here is the purpose of FMEA, with primary purpose being the key phrase. Failure mode and effects analysis, FMEA, is a proactive risk assessment tool used to identify possible failures in a process, system, or design, and evaluate their potential effects. This contrasts with root cause analysis, RCA, which is reactive. For example, before implementing a new chemotherapy administration process, an FMEA would help predict where errors might occur and what their impact could be, allowing for preventative measures to be built in. Always remember that FMEA is about thinking ahead and preventing problems. Question 20. A quality professional is developing a dashboard to track key performance indicators, KPIs, for patient safety. Which type of data is most appropriate for establishing a baseline and monitoring trends over time? A. Cross-sectional data. B. Qualitative data. C. Time series data. D. Nominal data. Answer: C. Time series data. This question focuses on the appropriate data type for establishing a baseline and monitoring trends over time for KPIs. Time series data, which is a sequence of data points indexed, or listed or graphed in time order, is specifically designed for tracking changes and identifying trends or patterns over a period. For example, plotting monthly surgical site infection rates over the past year is time series data, allowing you to see if the rates are stable, increasing, or decreasing. When you need to observe how something evolves, time series data is your most reliable option. Question 21. Which of the following scenarios best illustrates waste as defined by lean methodology in healthcare? A. A nurse spending extra time comforting a distressed patient. B. A hospital investing in new, State-of-the-art medical equipment. C. Patients experiencing prolonged wait times in the emergency department due to inefficient triage processes. D. A physician ordering an MRI based on clear clinical indications. Answer: C. Patients experiencing prolonged wait times in the emergency department due to inefficient triage processes. This question tests the understanding of waste within lean methodology, which defines waste as any activity that consumes resources but does not add value for the patient. Prolonged wait times, as described, are a classic example of waste, specifically, waiting waste, resulting from inefficient processes, as the patient gains no value from waiting. In contrast, comforting a patient or ordering a necessary MRI are value-adding activities, and new equipment can be value-adding if used efficiently. Lean focuses on identifying and eliminating these non-value-added delays and inefficiencies to improve patient flow and experience. Question 22. A hospital is implementing a new patient education program for chronic disease management. To ensure the program is effective, what is the most important factor to consider when designing educational materials? A. The materials are branded with the hospital's logo. B. The materials are developed for a 12th grade reading level to ensure comprehensive information. C. The materials are tailored to the patient's health literacy level, cultural background, and learning preferences. D. The materials are presented exclusively through digital platforms. Answer: C. The materials are tailored to the patient's health literacy level, cultural background, and learning preferences. This question emphasizes effective patient education, with most important factor as a key clue. Effective patient education programs must consider the individual patient's health literacy, the ability to understand health information, cultural background, and personal learning preferences to ensure the information is truly understood and acted upon. For example, providing materials in plain language, using visual aids, offering options for in-person or digital learning, and respecting cultural beliefs are all vital. Ignoring these factors can render even the most accurate information useless, leading to poor adherence and outcomes. Question 23. What is the primary purpose of a Pareto chart in quality improvement? A. To track process performance over time. B. To display the distribution of continuous data. C. To identify and prioritize the most significant causes or defects by showing their frequency in descending order. D. To illustrate the relationship between two variables. Answer: C. To identify and prioritize the most significant causes or defects by showing their frequency in descending order. The question asks for the primary purpose of a Pareto chart, a fundamental quality improvement tool. A Pareto chart combines a bar graph and a line graph, where individual values are represented in descending order by bars, and the cumulative total is represented by the line. This helps teams focus their improvement efforts on the vital few problems that contribute most to the overall issue. For example, it might show that 80% of patient complaints come from only 20% of service issues, allowing the team to prioritize fixing those key issues. Remember, Pareto charts help you pinpoint where to start for the biggest impact. Question 24. A quality professional observes that a particular surgical complication rate consistently hovers around 2 to 3% each month, without any sudden spikes or drops, despite various minor process adjustments. This type of variation is best described as A. Special cause variation. B. Assignable cause variation. C. Common cause variation. D. Uncontrolled variation. Answer: C. Common cause variation. This question distinguishes between types of process variation, with consistently hovers around 2 to 3%, without any sudden spikes or drops, despite various minor process adjustments as key descriptors. Common cause variation, also known as random or inherent variation, is present in any process and is due to the cumulative effect of many small, unavoidable causes. It represents the natural, expected range of variation for a stable process. For example, slight variations in surgical complication rates that fall within an expected range are often common cause, suggesting the system itself needs fundamental redesign to improve, not just minor tweaks. Question 25. An important ethical consideration for quality improvement initiatives in healthcare is to ensure that A. All improvement data is kept confidential from patients to avoid alarm. B. The focus is solely on cost reduction, even if it impacts staffing levels. C. Patient safety and well-being remain the paramount objective, and the rights of individuals are respected. D. Data collection is minimized to avoid burdening staff with extra tasks. Answer: C. Patient safety and well-being remain the paramount objective, and the rights of individuals are respected. This question focuses on ethical considerations within quality improvement. In healthcare quality, the ethical imperative is always to prioritize patient safety and well-being, ensuring that improvement initiatives are conducted with respect for patient autonomy, privacy, and beneficence. For example, when implementing a new protocol, it's crucial to consider not only its effectiveness but also its potential impact on patient experience and rights. All quality efforts must align with the core ethical principles of doing good, avoiding harm, and respecting individuals.